The COVID-19 situation in the Northwest Territories remains dire. Officials recorded 286 new cases over the past week. That's a jump of more than 55%. After maintaining low case rates throughout the beginning of the pandemic, the territory currently has the highest rate of active COVID-19 cases in the country, more than Alberta. Caroline Cochrane is the Premier of the Northwest Territories. She's in Yellowknife. Premier, nice to see you. Thanks for taking the time today.
Thank you for inviting me, Paul.
So in the Northwest Territories, cases up 55%. You have the highest rate of active cases in the country right now. What's happening? What is driving up these infections?
Well, I think what's happened is, for one, we're a victim of our own success. We were very fortunate in the first, second, and third waves throughout Canada. We were very diligent. We were very firm in our orders, and people were isolated from the first, second, and third waves. But as with every jurisdiction, people need to be able to travel. They need to see their loved ones. So once we started opening up our borders a bit, we knew it would happen. And of course, COVID hit hard. And it hits us hard because of our small population, over 33 communities, less than 45,000 people, and the lack of health care infrastructure within those communities. So that's where we are today. You
know, when I think of your part of the country, I think of things like what you just described. I think of isolated communities. I think of tough terrain broadly. I wonder how much of a factor that is at this moment for you, that people are, and as you note, fewer resources with which you can try to deal with this.
Well, isolation has been a factor. The lack of infrastructure, road systems to communities. Right now, the biggest amount in our outbreak currently is in our capital city, and Indigenous community that's very close to us in proximity. So it does make it more challenging when it's in a capital city, of course, because it's harder to do the contact tracing. It's harder to confine people, do the enforcement. But at the same time, it contains it into the area where we have the better healthcare facilities and less risk to the smaller communities. Although it has been in small communities, and it's in 10 of the communities currently right now.
Am I right to say that all of the deaths have been in the Indigenous communities? Can you describe the sort of acuteness of the problem there?
Well, at this point, I can't say the nationality of the deaths. We've had 6 deaths, and because of the amount, it's hard to identify any characteristics without maybe potentially identifying people, and out of respect for families, because these deaths have just been since this last outbreak. So currently we have had 6 deaths. And as one of our chiefs told me way back at the beginning of the pandemic, every life is valued, and no death is okay.
Indeed, and I wasn't trying to put you on the spot there, so I respect what you had to say on that. Let's talk vaccinations for a moment. Northwest Territories, what is it? I think it's more than 75% vaccination rate among those eligible, and yet you're struggling with this surge. I mean, how much of a factor is waning immunity from the vaccines in this current wave?
Well, there's a number of factors. The waning immunity is something we're looking at currently, and that's why we're offering boosters to people 75 and older. We're looking at that as we go further. You're right, 79% of our population is fully vaccinated, and 83% are under vaccinated or have first vaccinations. The problem is that it's not right across the board. Again, we have 33 communities. So one community, Kakiza, one of our smallest and so proud of, has 100% of their residents that are eligible for the vaccination are vaccinated, 100%. And yet we have other communities where the vaccination numbers are so limited. And I think that's a lot our communities are outside of the capital are mostly Indigenous people. There's a trust factor. There's survivors of residential school, colonization, etc. So those are the communities we're focusing our efforts to get the vaccination numbers up.
And what are you doing to resolve the trust question? And that's a question to politicians everywhere, but where you stand, what is your message to people who are hesitant or wary?
Well, as the Premier of the Northwest Territories, I tell everyone, do it. Do it for yourself, do it for your loved ones, do it for those you care about, do it for our elders and those that are vulnerable. However, in saying that, again, we can't do this alone. And so we work very closely with our Indigenous and governments and the municipal governments to help enforce the message for people and to help alleviate their fears. No one knows their people better than the chiefs in their communities. So it's important that we work with them.
You know, we're talking earlier about resources in the north, and one of the things you always hear in these circumstances wherever there's a surge is how ICUs can get overwhelmed. What's it like right now where you are?
Well, we've had a total 14 patients have been in the ICU units. We only have 6 ICU beds, and so currently we've been moving around our hospital to try to accommodate. But the oxygen is high-flowing oxygen that's necessary to deal with people that have COVID. And so, again, we've reached out to the federal government. They've sent in some equipment to help us, and they're going to be helping us now.
What do you need?
To address the need.
What do you want from Ottawa? Yeah, and indeed, they've sent some assistance, right? I think people and gear, if I'm right. What's the ask to Ottawa?
Well, the ask right now is for oxygen. So they will be sending out, we've asked them currently for and I don't know the right term for it. It's kind of like an emergency hospital unit that can come in, that can have the oxygen compressors that are needed to be able to support patients as necessary. So that's the ask we've asked for right now.
I've got to say, Premier, you look like the weight of the world is on your shoulders. I mean, you're Premier, but you're also a resident and you're a Northerner. How are you feeling right now about as you see this playing out the way it is around you?
Like every other person in Canada, every person in the world, this is worrisome. This is not only affecting ourselves, this is affecting our loved ones. This is affecting our history, where we are and our future. So it's really important that the decisions that we make are the best that we can at the time, so that our future is preserved and that we can protect our residents. But again, one wise person told me, or I read one time and I carry it with me, it says, do the best you can until you know better. And once you know better, do better. So as we said, we're always looking at updating, we're looking at being current, we're looking at changing as necessary. Our focus is on the health and safety of residents.
Wise words, Premier. Thank you so much for your time.
Thank you.
Premier Caroline Cochrane.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.